Composite fillings. Composite fillings are tooth-colored to blend in with the remaining natural part of the tooth. Fillings are used to restore areas of your tooth affected by decay. Dentists use both amalgam, silver, and composite, tooth-colored materials to fill in the surface of the tooth after all decay has been removed. Where possible, aesthetic bonding of composite material to front teeth is generally much less expensive than veneers or crowns. However, bonding typically does not last as long as veneers or crowns. Reasons for fillings: restoring small to medium-sized cavities, restoring a chipped anterior front tooth. What does a filling involve? First, Dr. Morales, Dr. Garcia, or Dr. Yazback will answer any questions you have and will apply anesthetic to the tooth requiring the filling. Then, Dr. Morales, Dr. Garcia, or Dr. Yazback will thoroughly remove the decay that is present and prepare the tooth to successfully bond with the composite material. For more information on the dental tools we use, or if you are searching for a specific tool or technique, contact one of our dentists at our Coral Gables, Florida, 33146, 786-724-0577.